Welcome to the SacMap Community Workshop, where we will be talking about accessing behavioral health resources in Sacramento County. I'll be your presenter today. My name is Stephanie Ramos. I'm the Education Director at Cal Voices and oversee the SacMap project. I've worked in the field for over 17 years, and I work in this field because I have a sibling who has severe mental health challenges. She does receive services in the county behavioral health system. And, as long as I worked in the field, I've always known people who are running programs, people who might be working at the county level. And I feel like I've always had someone to call if something goes wrong. And even with that, we still continuously run into challenges and barriers when trying to access care for my sibling. And it kind of keeps me here because I recognize that many of our community members don't have the same access, don't have the same support, aren't able to reach out and make that call when something's not going right. And so just having that information and knowing that so many people are still out there struggling and finding and accessing services really keeps me kind of in my role and wanting to work in the behavioral health field. The SacMap project is a program of Cal Voices. We were originally funded by the Sacramento County Division of Behavioral Health Services through Proposition 63, also known as the Mental Health Services Act. And the SacMap project seeks to decrease prolonged suffering by making the process of seeking, finding, and accessing behavioral health services understandable and accessible. When we were first figuring out what we wanted to do for this project, we recognized that there were a lot of services out there, but that most people didn't know about them. And that was a huge barrier to recovery for people, was being able to find the resources and supports that they needed. Our agency, Cal Voices, was founded in 1946. It's the oldest continuously operated consumer advocacy agency in California. We're peer-run, so that means that we specifically hire individuals with lived experience, whether it be an individual who has experience in recovery from a mental health challenge, or someone like myself who is a close family member, someone who was involved in navigating services with their family member, helping them advocate for themselves and things like that. You might not know us by Cal Voices. You may know us as a former name, like NorCal MHA, Mental Health America of Northern California, or Mental Health Association Sacramento chapter. So in this workshop, we're going to learn about mental health and recovery, Sacramento County Behavioral Health Services, and we're going to give you a website tour and show you where some tools are available on the website that you might utilize for yourself or someone else that you might be supporting. So let's jump into part one, where we'll talk about mental health and recovery. So we want to put out some definitions here, right, around mental illness, around mental health. And when we talk about mental illness, we know that a lot of people don't like that term, and we're not a big fan of it either, but we want to use it in this narrow context with limited meaning. Here we use the term mental illness to refer to a current state or condition of unwellness, and we're not referring to a specific mental health diagnosis. So let's first look at mental illness. SAMHSA defines mental illness as a serious functional impairment that substantially interferes with or limits one or more major life activity, such as basic daily living skills, instrumental living skills, and functioning in social, family, and vocational educational contexts. Now let's look at mental health. The Center for Disease Control says that mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. And when we put it that way, we all have mental health, right? It's also important to recognize that poor mental health and mental illness are not the same thing. These terms are often used interchangeably, and it's important to recognize that they are distinct experiences, where a person can experience poor mental health and not be diagnosed with mental illness. And likewise, a person diagnosed with mental illness can experience periods of physical, mental, and social well-being. We know that mental health challenges are common. More than 50% of individuals will be diagnosed with a mental illness or disorder at some point in their life. 1 in 5 Americans will experience a mental illness in a given year. And 1 in 25 Americans live with a serious mental illness such as schizophrenia, bipolar disorder, or major depression. So this is really an issue that impacts all of us, right? If it's not ourselves working on living in recovery, it may be a family member, a friend, a neighbor. It could be a client if we're working in the system. And it's really common and something that we want to keep in mind kind of as we're out there, living our own life and addressing any issues that might put us at risk. Now, risk. Let's look at these risk factors for mental health disorders. And like many other illnesses, certain things can put us at risk. We do know what makes people more vulnerable, and these are called risk factors. Each of these is an independent risk factor, and the more you have, the greater your risk. Now, let's go through each of these. A family history. This is a biological connection to someone who's been diagnosed with a mental illness or has experienced mental health problems, addiction, suicide, or suicide attempts. This also refers to an individual's previous history. So I have a sibling who has severe mental health challenges, which means that I'm more at risk for developing one, right? Even if my sibling didn't have that condition anymore, but maybe previously had it, it does put me at risk as well. Personal history. If someone's had a previous episode of a mental illness, they're more at risk of having another episode than someone who's never had one, right? So if I'd have had a previous episode of depression, I'm more likely to have another episode than someone who hasn't. This can also include chronic medical conditions. So when we talk about a personal history, it's not just having a personal history of mental health. It could be other physical health issues like hypertension, congestive heart failure, diabetes. It could be a lot of other things that we are experiencing chronically. Trauma is another risk factor. And this can refer to chronic trauma, like living through a war or child abuse or domestic abuse. It can involve being the victim of a crime or witnessing violence. It can also refer to physical trauma, like being in a car accident or having a significant illness or injury. It can also refer to a critical traumatic incident, like being in a fire or bank robbery. Now let's look at environment. Environment, they're the psychosocial conditions in which someone lives that might create substantial risks, such as exposure to ongoing violence, neighborhood poverty, or institutional stigma and discrimination like racism. It could also include the environment in which someone was raised. Did they have an inadequate parental involvement and supervision? Did they have parents with substance use histories? Was there a lack of healthcare and other resources? Did they experience peer rejection? All types of things. And our environment puts us at risk, even if we don't live in that environment anymore. So the last two are personal stress and social isolation. So personal stress involves significant financial problems, relationship problems, housing problems, problems with children or parents or other family members. This can also include workplace stress. And this involves work overload, chaotic environment, changing priorities, high demand with low control, a lack of resources, a lack of training to do our job well, and a very significant stressor, lack of social support at work. And lastly, social isolation is a risk factor for mental health disorders as well. There's research into social prejudice and stigma that seems to be finding a link between social isolation and increased risk for developing a mental illness. Also, research into disability rates is finding a possible link between social isolation and an increased risk for depression. This is seen when an employee goes off of work for a physical health issue and then develops clinical depression, which keeps them off work even after they returned from the physical health issue. So with risk factors, you want to remember that even one of these means that you're more vulnerable. If you have even one, you may want to take a look at how you take care of your mental health to minimize the impact of the risk factor. So prevention and early intervention is really important in the work that we're doing. The earlier access to care that someone gets can help mitigate additional negative effects of untreated mental illness, such as homelessness, suicide, school failure and dropout, unemployment, and incarceration. And this is really the idea is we want to get people help before things get really bad, right? Before we start to see these negative effects. Now, I do want to say that mental illness doesn't necessarily always cause these issues. Right? There are other things that we experience in our society that can put us at risk of homelessness, like not having affordable housing, right? That can put someone at risk of homelessness, even if they don't have a mental illness. Same thing with incarceration, right? We have incarceration rates are higher for individuals from more diverse communities. So whether or not someone has a mental illness, we know that they're more at risk, right, of experiencing incarceration than another population. So even though mental illness can have some of these negative effects, it's not the only cause of those things. So there are benefits of receiving mental health services. And through getting services, so we're trying to get them early, right, before things get real bad. And we know that just by getting services, it can help us kind of sometimes better our whole life, right? So we might learn how to manage our stress better. We may learn how to reduce conflict and strengthen our relationships. We may improve our communication skills. We might learn some great coping skills. We may gain hope for the future, right? My future doesn't have to look how it looks today. It could look brighter and better. We hope to reduce isolation by getting mental health services and ultimately helping us to work productively. Now, recovery is real. Some of you may already know this. Some of you might be wondering, can I get better? Can my loved one get better? And there are longitudinal studies that demonstrate that most people who have struggled with a mental health challenge, even a severe mental illness, can and do get better. For some people, symptoms diminish or disappear completely, even without medication. One of the most robust findings in schizophrenia research is that a substantial proportion of those with the illness will recover completely, and many more will regain good social functioning. Much recent research suggests that working helps people recover from schizophrenia, and advances in vocational rehabilitation have made this more feasible. A growing body of research supports the concept that empowerment is an important component of the recovery process, and that user-driven services and the focus on reducing internalized stigma are valuable in empowering the person with schizophrenia and improving the outcome from illness. So just always reminding ourselves that recovery is real, right? And there might be different ways to get there for different people. Now, I think kind of just like I said, if there's different ways to get there for different people, we're really recognizing that recovery is complex. Recovery means different things for different people. It can be viewed as both a process and an outcome. And recovery is more than just the absence of symptoms of a mental health disorder, right? When we're thinking of recovery, we're thinking broader, thinking about our whole life, not just a condition. So let's take a moment and quickly think about recovery. Knowing that it means different things to different people, what does recovery mean to you? Well, what is it actually, right? So in 2012, SAMHSA came out with a working definition of recovery. And their definition is that recovery is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. And now I'll tell you, I really like this definition for a couple of reasons. One of them is, if you notice, it says improve their health and wellness. It doesn't say improve their mental health and wellness. So what does that mean? Right? When we talk about health, we're talking about bigger. How's my physical health, my mental health, my spiritual health? Like when we're talking about health and wellness, we're talking about our overall well-being, not just our mental health. So if we're working on recovery, supporting others in recovery, we want to look at it through a more holistic lens, right? Are we addressing different aspects of their life, not just the mental health piece? And that can be, difficult sometimes, because if someone's really struggling with their mental health, we may kind of zoom in all of our efforts and supports on the mental health piece, and other parts of their health might, not get as much support. We could deteriorate in other areas. We might not be getting our healthcare checkups because we're focusing on the mental health piece so much and not recognizing that all those other aspects are going to impact our mental health as well. In this definition, I also really like that it says live a self-directed life. And I don't know about you, but I am a natural helper, rescuer, and fixer. And so for my family member, I would often jump in and try to direct her life, right? Because I was worried, I was scared, I was nervous, I was concerned. I had all of these needs going on with myself. And so I began to self-direct her life. And let me tell you, that takes a lot of energy and a lot of time. And I also learned years later that that was not the most helpful thing for her. What if something happened to me? Who was going to make her appointments? Who was going to advocate for her? Who was going to give her reminders to get labs done, right? Who was going to help her make major decisions in her life? And, I had to realize that, hey, these are skills she needs to have herself. Because what if someone isn't around to do those things? And when we think about recovery, a self-directed life is part of recovery. So if, as a supporter, as a loved one, I want her to recover, I really need to be thinking about how are we creating space for her to be the director of her own life, the driver of her own life. And that doesn't mean without support, but it's about giving individuals the autonomy to learn how to and make choices. Now let's jump into part 2, where we're going to talk about Sacramento County Behavioral Health Services. So Sacramento County Behavioral Health provides a full array of culturally competent and linguistically proficient mental health and substance use services to individuals of all ages. Services include prevention and early intervention, outpatient services, case management services, crisis intervention and stabilization services, inpatient psychiatric hospitalizations, and substance use prevention and treatment services. Now, with the SacMap project, we really tried to focus on the types of services available, right? And so in this section, we're going to go over phone lines, wellness centers, respite services, outpatient, crisis, suicide prevention services, as well as inpatient and substance use prevention and treatment services. And with the SacMap website, we really tried to focus the resources and information on programs and services that were accessible without having to get a formal evaluation or referral. And so many of the resources you'll find on the SacMap website, you can access directly, right? And we're going to go through what those types of services are. Now, before we do that, I want to take us back to recovery for a moment. If we're considering the concept of recovery, we should recognize that there are many pathways to recovery. Recovery is highly personalized and may include different treatments, services, and supports. So we don't want to limit ourselves or others to a one-size-fits-all. We might find that one type of service works really well for us, or it could be a combination of services and supports that will best meet our needs. Now let's jump into phone resources. These mental health services and supports are accessible by the phone, either by calling or texting, and they offer immediate assistance and counseling, as well as connection to local resources. And 2 examples of those programs are the Amala Youth Hope Line and the Consumer Operated Warm Line. The Amala Youth Hope Line is a free and confidential compliant. Now let's jump into phone resources. These mental health services and supports are accessible by phone, either by calling or texting. And they offer immediate assistance and counseling, as well as connection to local resources. Examples of those programs are the Amala Youth Hope Line and the Consumer Operated Warm Line. The Amala Youth Hope Line is a free and confidential peer counseling service for Muslim youth, and young people can reach out just by calling or texting. Another example is the Consumer Operated Warm Line. And this is a non-crisis phone line. So this is before someone's in a crisis, right? Maybe they're starting to feel unwell, or they just need to check in or just need to talk. They're able to offer supportive listening, referrals to mental health resources, and they also provide wellness recovery action plan groups. And in these groups, individuals are able to identify things they need to do daily to stay well. They're able to identify their triggers. They're able to identify things in their life that keep them well. They're even able to identify, what do I want when I'm in a crisis, right? So it's a plan that's developed by the individual to help them manage their own mental health challenges. Now, both of these phone resources are free. And just like the rest of the resources we'll share, information on how to contact them, the types of services provided are available on the SacMap website. And in part 3 of this workshop, we will give you a brief tour where you can find that information. The next type of resource are the wellness and drop-in centers. And these are community-based multi-service centers that offer an array of comprehensive services and wellness activities designed to support clients in their recovery goals. Examples of these programs are the Wellness and Recovery Center North and South and the Wind Youth Drop-in Center. The Wellness and Recovery Center is staffed by wellness mentors. It's absolutely free, and it offers a lot of different groups and activities like meditation, coping with anxiety, art expression, a computer lab, ping pong. If you need to talk, you can also meet one-on-one with a wellness mentor for peer counseling. And my family has actually benefited a lot from the Wellness Center. One of the things that my sibling finds to be really helpful when she's working on her recovery is to have structure and routine. And even though she's connected to a full service partnership, which is an intensive outpatient type program in Sacramento County, she still needs support in creating daily structure and activities. And so a couple of times a week, she's able to go to the Wellness Recovery Center and spend a few hours there, go to some different groups, connect socially with some of the other individuals who are participating at the Wellness Center. And so some people may find that their outpatient program is really great, and that's all they need. Other people might find that, I have my outpatient program, but I would really like to go to a wellness center and hang out and meet people and go to some groups. You might also have individuals that maybe they don't qualify for those outpatient programs, but they could still use some support, right? And a lot of the resources we're going to share, including the wellness and drop-in centers, are accessible to everyone. So another example of the wellness center we wanted to share with you is the Wind Youth Drop-in Center. And this is a safe, non-judgmental space for homeless and runaway youth. And through the drop-in center, young people are able to really find a welcoming and age-appropriate environment, right? And they're able to have access to a health clinic. They're able to get a warm meal, get some peer support. They might get support in getting access to their California ID or birth certificate. They provide support around employment and education. They have different workshops. I think our youth can even go there to get a shower. They have drop-in counseling, crisis intervention. They have some respite. So with the wellness centers, they really try to be a one-stop shop where individuals can go to get their needs met. Now let's jump into respite services. Respite services provide a safe environment where participants can increase their knowledge of available supports and how to access them, improve their well-being, reduce stress, increase connectedness, and reduce feelings of isolation, decrease risk of harm, and ultimately reduce visits to the emergency room and psychiatric hospitalizations. Some examples of those programs are the Q-Spot and the Ripple Effect. So the Q-Spot is administered by the Sacramento LGBT Community Center. They provide drop-in mental health respite care and supportive services to unserved and underserved youth ages 13 to 23 who identify as LGBTQ. And a lot of their activities focus on decreasing suicide risk, promoting healthy relationships, as well as life skills development. Another example is the Ripple Effect, and this is a peer-run mental health respite service that provides a temporary safe space for individuals experiencing a mental health crisis, but who are not in need of a psychiatric hospitalization. The Ripple Effect is peer-run. They provide peer counseling. They help individuals develop a plan to resolve any problems that they may be experiencing. They're able to provide referrals to other resources. They are LGBTQ friendly, and they provide their services in both English and in Spanish. And you can, reach out just on the phone to get an appointment and get some support there. And I do want to mention that due to the pandemic and COVID, many of the programs have adjusted their hours for the safety of staff and consumers. So I'd highly recommend calling before you go just to ensure that they are available to support you. Now we're going to jump into outpatient services. So outpatient services, I like to explain, are kind of like the medical service on the mental health side. So if you were to get physical health care, you would usually go to a primary care doctor, right? So if you're getting a higher level of mental health care, you often would get outpatient service through a psychiatrist or something like that. Services may include counseling and psychotherapy, medication support services. You may get case management. You might get some assessments done. They may help you develop a plan. And they also provide evaluation and monitoring. So really just kind of that ongoing care to make sure that your mental health is taken care of. Now, with outpatient services, on our website, you'll notice that we did not list the individual outpatient providers. Unlike the other programs and services on our website, outpatient services have to be accessed through the Access program, which is in Sacramento County. And so I'm going to go through that process with you just to ensure that you understand how that works. So if somebody were in need of outpatient services, they would call the Access team. The Access team would then conduct an assessment to determine what level of service does this individual need, Do they meet medical necessity to receive services through an outpatient program? And do they have the right insurance in order to qualify for that program? So we call the access team. They do an assessment to make sure we qualify. If we qualify, they will give you the provider's name and telephone number. And then the provider will contact you to set up an appointment after the access team authorizes services. So again, we do not list the individual outpatient providers on the SacMap website, because if you call them directly, they will tell you that you have to call the access team. And we want to make sure that the first number you call is the right one. One great thing about the access team is they really try to ensure that individuals do not leave empty-handed. So even if you don't qualify for outpatient services through Sacramento County, they do often try to find an alternative resource that you can utilize or program that you can reach out to ensure you get your needs met. The next type of service I wanted to go over are crisis services. And these services provide mental health support for people with a mental health problem that cannot wait for a regularly scheduled appointment. So that is how we're defining crisis. You're having challenges in the moment that are so severe that you cannot wait for a regularly scheduled appointment. And some examples of those programs are inpatient care, urgent care, respite care, and phone support. And inpatient care is often known as hospitalization, and that might be needed for someone who needs to be closely monitored to provide an accurate diagnosis, to help adjust or stabilize medications, or during a severe episode. And those inpatient services could include a mental health assessment, stabilization of acute symptoms, medication management, some support groups, referrals, and discharge planning. And inpatient care often has some really strict eligibility guidelines. And this is where an individual might not be able to be safely treated at a lower level of care. And because of the mental illness or symptoms of the mental illness, individual is showing a danger to themselves or others, or they're prevented from providing for or using food, clothing, or shelter. They may present a severe risk to their physical health. They might have had some deterioration in functioning. They may need some evaluations. So inpatient care is more that higher level intensive intervention type services offered in a crisis. Sacramento County also offers the Mental Health Urgent Care Clinic, and this is a walk-in clinic for individuals who have an urgent mental health need. Okay, so maybe not to where they need hospitalization, but again, they can't wait for a regularly scheduled appointment. And the services offered through urgent care include counseling, crisis intervention, evaluation and assessments, peer and family support, referrals and linkages to community resources, as well as brief medication management services. They don't turn anyone away due to the lack of funds, and they do accept Medi-Cal. And like many other programs due to the pandemic, they may have varying operating hours. So again, we would encourage you to reach out before showing up at the Mental Health Urgent Care Clinic. Crisis services are often also offered through respite care and phone support. And we're not going to go over these in this section because we went over them in previous sections, but you will find on the SacMap website, there is a page dedicated to crisis services where you can find a variety of services that are provided in different ways. Now, let's jump into suicide prevention services. The suicide prevention services in Sacramento are offered through a variety of programs that provide culturally appropriate suicide prevention support services. Years ago, Sacramento County funded a group of suicide prevention services known as Supporting Community Connections. Two examples we want to share with you are through the Asian Pacific Community Counseling Center as well as the Living Room. So the Asian Pacific Community Counseling Supporting Community Connections program serves the Cantonese, Hmong, and Vietnamese-speaking communities in Sacramento County. The program really aims to bring awareness, reduce stigma, increase protective factors, reduce risk factors, and lend a voice to these communities. They offer a variety of services, including suicide prevention education. They have classes like computer skills, language, ballroom dancing, and more. They also offer support groups and community building activities. Another example is the Living Room African American Suicide Prevention Program. And this program provides a calm and safe environment in which guests can resolve crisis without more intensive interventions. And services are offered at 2 locations across Sacramento. Services include crisis intervention, individual peer counseling, transportation, case management, mental health and social services referrals, as well as support groups. And there are a variety of other suicide prevention services that you can find on the SacMap website. The last type of service I wanted to go over with you are substance use prevention and treatment services. And they provide a variety of services when we're talking about substance use. There are a lot of different programs and services available. But a quick overview, they're able to provide prevention services. And these are for folks who might be at risk of developing a substance use disorder, but haven't been determined to require treatment for substance use. They have outpatient services, and this would include intake and assessments, treatment planning, individual counseling, group counseling, family therapy, and a variety of other services as well. Unlike mental health, in the substance use services, there's often a limited number of how long you can get services, how many hours, and things like that. Substance use prevention and treatment services also include intensive outpatient services, and this is where somebody might need an increased number of service hours to provide that additional support with them. We also have medication-assisted treatment. There is some withdrawal management or detox services available. There is residential treatment for individuals who may need a 24-hour non-medical short-term living support and structure. We also have collaborative courts and programs, and this is where we've combined judicial supervision and rehabilitation services to really support folks get help rather than do jail time. And more. So there are more services available through the substance use prevention and treatment services that are provided through Sacramento County. And when we get to the SacMap website, we will show you where you can find that information. So like outpatient services in mental health, with substance use prevention and treatment services, we need to determine the treatment and level of care needed to support recovery. So it could be a preliminary assessment that would be conducted, and based on that assessment, you'll get referred to a contracted service provider. So if you're in need of substance use prevention and treatment services, you'll want to reach out to the adult system of care or the youth system of care for substance use treatment. And again, that information is also available on the SacMap website. So can you think of programs or services that you have found helpful in the past? If there's anything in particular you have found helpful, I always want to encourage people to send us an email. Our email is sacmap@calvoices.org. And we really love to hear from the community and what has been working for them, because you may know of a great resource that we don't know about, and we would love to add that to our website. You may also want to think about what types of services are you looking for now? Right? What are you in need of? And kind of keeping that in mind as you go check out the SacMap webpage to see if you can find a support or service that meets your needs. Now, let's jump into part 3. So this is the last piece of the SacMap workshop that we are going to go over with you all. And in this section, we are actually going to provide you a brief tour of the SacMap website. So when you go to our SacMap website, which hopefully you found if you're watching this video, it's www.calvoices.org/SacMap. This is what you're going to see. All right. So at the top, we have our services broken down in a way that we are hoping is not overwhelming to individuals visiting the website. If somebody is in a crisis, we tried to lump all of the crisis services into one area. So that you don't have to go through all of these lists of services in order to find something that you need. We also try to group these. So you'll see if you come to the crisis resource site, I can click on respite. Like I'd really want to use a crisis respite program. Take me down to respite, and it's going to show me a variety of services available through the respite programs, right? And you'll see some services that we briefly mentioned, But these ones are specific for crisis. So if you're on the crisis page, everything on this page is going to be related to crisis. Again, if someone's going through it, we don't want you to have to spend so much time trying to find what you need. So I'm able to click on the logo. It will take me back to the home page. We also tried to group services by age group. If you go to the adult page, you're going to find all of the services available to those that are 18 and older. And there are a lot of services on this page. So we did try to group them by type of service, right? So if I'm wanting to get outpatient services, as you'll remember, we did not list the providers. However, we have the instructions. Here's what it may include. You have to get prior authorization. Here's the process, right? We want to make sure that folks know how to access that care. We can go back to the top. And maybe I'm looking for, what might we pick today? Wellness centers. So it's going to probably take us way down to the bottom. We're going to go to wellness drop-in centers, and here's a variety of services, right? And we did talk about the wellness and recovery centers and the WIN Youth services. So you can see here, we have the hours of operation, the addresses, phone numbers, the services offered, eligibility, cost, referral process. We really wanted to make it easy for individuals to find the services and supports that they need, regardless, of who they are. And so we wanted to really create one place that individuals could go. We have an older adult page. And through this project, we have found that there are not a lot of behavioral health services targeting older adults. And so, again, we did break these down by category. You'll find crisis services for older adults. This may include crisis services that are not specifically for older adults, but that we want to ensure that our older adult community and their supporters are aware of, just in case that they needed them. We also have, again, inpatient service instructions, outpatient service instructions, and then a variety of phone supports available to our older adults. Back to the top. And we're going to go back to our main page. We also have a section on children, youth, and young adults as well. When we originally created the website, we created a section for the LGBTQ resources, and then we thought to ourselves, what about our other diverse communities? And so we took out that section and created a page dedicated to diverse communities, where you can go and find resources, specifically for specific communities here in Sacramento. So we have our Al Afia for seniors, which is targeted towards Middle Eastern and South Asian older adults. We have the Gender Health Center, La Familia Counseling Center, Sacramento Native American Health Center. Lots of places individuals can go that may tailor their services and supports to specific communities. We did mention we have a substance use prevention and treatment section as well. And in here we have directions again on how do you access that specific treatment. And we wanted to provide other information like overdose emergency. What do we do? Services for adults, for youth, pregnant and parenting women, DUI programs, really anything kind of in the substance use realm. We wanted to put in one place again so that you can find that information easily. So let's go back home. We have a section on behavioral health information and advocacy. And in this section, you're not going to find services. You're going to find information about agencies. So if you're interested in mental health education, resources for diverse communities, if you're interested in policy and advocacy or learning about your mental health plan, there's a lot of information here that you can go through, and you may find that some of that is going to be helpful for you. We have some resources on COVID-19, which I know are probably becoming utilized a little bit less frequently, but we do have that available. A couple other things I want to share with you is we have an online resource finder. And this is where we take all of the resources that are listed on the website, whether it be in crisis services, substance use, whatever it is, and we developed a filtering tool. Now, I will say this is not perfect, but it is a way for people to narrow down services. Now, on this page, you'll see that there are a lot of services. So this is all the information that you would be able to find on the resource pages that we just went through. But this could be overwhelming, right? So maybe I'm looking for services for youth and young adults, and let's go for Black African American. So I'm a Black African American youth or young adult. I'm going to go to search, and it's going to narrow down some services specifically for the items that I identified. Now, the more filters you put in, the less results you get. So let me take out youth and young adults. I'll just leave that blank. We'll go to search. We still have our population for Black and African Americans, and you're going to see a few more programs that will pop up. And so, just like any tool, the more filters you put in, the less responses that you will get back. But maybe in this case, I'm going to put the Cantonese language, and I'm going to have a lot more show up, right? So these might not be agencies that specifically provide services to the Cantonese speaking community. However, somewhere within their site, within their staff, they have identified that they have language capacity to serve those communities. So again, this is just another tool to reduce the amount of information. As we know, this could be overwhelming for some people. So also on this page, so I'm going to show you again how I got here. So we are at the main page. I can click on the resource finder. And there are these two tools we want to show you. One of them is called My Personal Preferences and Resources. And on this page, we want to help people think about, what is important to them when they're selecting and participating in mental health services. Is it their values and beliefs, their religious affiliation? Could it be their gender identity or expression, their family responsibilities, their language? What's important to them when they're selecting a service, right? What's important to you? So, we want to think as we're looking through all these different services, how do I find something that's going to meet my need, right? If we're supporting someone else, we want to find out what's important to them, right? Maybe we're searching the internet for resources, but it's really helpful to find out, is their gender identity important to them, right? Because that's what I'm going to look for. I'm going to look for programs who can honor that. The second half of this page, we ask folks to check the resources that they have to support their participation in a mental health service. Now, over the years, I found this to be very important to find out. I have worked in varying roles within the behavioral health system, and oftentimes I find myself searching for a service or program to help meet the needs of an individual or family. And sometimes I forget that in order to access certain services, you need certain resources, right? In order to get somewhere, I might need a vehicle, I might need a ride, I might need public transportation. So I want to identify, what do I have that's going to support my participation in that service? For example, our SacMap program, we like to encourage people to attend. And I remember somebody told me, how do I find out about mental health resources in the county? And I very happily encouraged them to attend one of our SacMap workshops. And then they told me that they have the free government phone and they do not have enough data to download Zoom to participate in the SacMap workshop. So even though I had the best intention, I had a great resource, they did not have the personal resource available to them in order to access this support. So if we are finding resources for ourselves or for other people, we want to think about, what resources do we or do they have that's going to support our participation in that particular service? So I'm going to go ahead and go back. Another tool we have is this resource worksheet, which I'm sure many of you have had a list before that you made, right? So this is a list. We're identifying a program, a service, contact information, and some notes about programs. Because often we might see or hear about a program we think sounds great. We write it down somewhere, never see it again, right? And something with resource lists that we have found is that a list can be helpful, but it can only be so helpful, right? So we want to be thoughtful as we create our list. So here's an example. Maybe an individual has identified Danelle's Place as a service or support they want to utilize. So when they list that resource, they're going to identify the program name as Danelle's Place. They're going to participate when they would like to utilize the rest and relaxation services. We have the phone number, we have the address, and in the notes section, we are going to identify a few things. When are they open, right? So they're open Monday through Friday from 12 to 3. They're LGBTQ friendly. I'm going to go when I get mad at my roommate and I'm going to explode. And in order to get there, I need to take the bus. So I'm going to jump on the light rail and take bus 67. So as we're creating resource lists, whether for ourselves or someone else, we want to identify that important information that we need to know in order to access it, so that in the moment when I need it, I can just, jump in and say, okay, they open Monday at 12. I'm going to make sure that I get there at 12 because I know I'm getting triggered by my roommate, and okay, I need to take bus 67. So all that information is available, right? We're not stressed out trying to figure out how we're going to get there. So I'm going to take us back to the homepage. And I do want to mention that the SacMap, all the information on the SacMap website is downloadable. So you can download this resource guide where you will find all of the information on the SacMap page. You're going to find here in this long guide. But we know, some people don't always have access to Wi-Fi. I don't know about you, but I also like to circle and highlight and write on things. So you will be able to download this very large printable guide with all of the resources we mentioned, plus some more information you probably never asked for. But we wanted to make sure that folks had this available, whether you print it for yourself, for a family member. You should be able to find a variety of resources throughout the community. And it's nice to be able to download it and take it with you anywhere you go. One thing I also wanted to mention is that the website is translated. So you can come up to this corner, click on this arrow, and I can click on Spanish, and you'll see that it translates. I will say for us that translation is always in progress. So we are constantly going in and checking things. If you find something that is an error, you can shoot us an email at sacmap@calvoices.org, and we will do our best to go in and make any corrections. We also will be having some translated resource guides available in the future. So that's something that we would encourage people to come back and check out. Again, this is an overview of our SacMap project, and we are really excited to be able to share all of this information with all of you. So just a few more things. Today we learned about mental health and recovery, Sacramento County Behavioral Health Services, as well as the SacMap tools. If you would like to get in touch with us, you can check out our website, www.calvoices.org/SacMap. You can email us at sacmap@calvoices.org. You are welcome to give us a call as well as 916-376-7736. And we always encourage folks to check us out on social media, where you can stay up to date with a lot of things going on at Cal Voices. Again, if you find any resources that you think that we should have on our site that we don't, if you find any maybe information that needs updated, again, reach out to us and we'd be happy to get any feedback or suggestions that you have.